everyone! Today's lesson from ACLS Certification Association is on bradycardia with a pulse algorithm. Don't forget to visit us online at aclscertification.org to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now let's get started. Assessing arrhythmia in the context of patient condition. In this bradyarrhythmias segment, we highlight patients presenting with acute symptomatic bradyarrhythmias. The interpretation of ECG findings must be within the context of the patient's clinical condition. This is assessed by performing a full physical examination and obtaining a patient history. Information must be acquired, including the patient's ventilation and oxygenation status, heart rate, blood pressure, level of consciousness, and assessment for signs of shock. Of course, a 12-lead ECG is necessary. However, if we base the treatment of the patient on ECG findings alone, there is the potential for errors in the management of the patient. We shall simplify the overall status of the patient in this algorithm and designate them as stable or unstable. Stable patients have normal vital signs and present with no serious clinical signs and symptoms. However, these patients will still have an abnormal ECG in terms of heart rate. Stable patients present with clinical signs and symptoms that are directly related to bradyarrhythmia. Common symptoms include 1. Palpitations, 2. Lightheadedness, 3. Dyspnea. Although symptomatic, these patients are not in imminent danger of cardiac arrest, and there is plenty of time to decide whether treatment is necessary. Unstable patients will present with these signs and symptoms but will also display symptoms of instability, such as altered sensorium and/or other clinical presentations of severely compromised perfusion, oxygenation, and ventilation. Cardiac arrest may occur if no immediate intervention is pursued. Clinicians must decide if the patient's signs and symptoms are brought about by the arrhythmia itself or by another underlying condition. For example, patients with thyroid storm will present with unstable supraventricular tachycardia. Performing synchronized cardioversion is futile unless the clinician addresses the effects of hyperthyroidism on this patient. Hence, in this case, giving beta antagonists and antithyroid medications precedes synchronized cardioversion, unless the patient is very unstable and cardiac arrest is likely. As another example, treating bradycardia with atropine is futile if the patient's condition is brought about by severe hypoxemia. In this case, optimizing ventilation and providing oxygen supplementation would supersede administration of atropine or cardiac pacing interventions. Due to significant loss of cardiac output in bradycardia, patients will show signs and symptoms of hypoxemia. To compensate, they will have an increase in respiratory effort, tachypnea, intercostal retractions, and paradoxical breathing. Patients' vital signs must be monitored with attention to oxygenation and ventilation. A pulse oximeter is recommended to monitor arterial oxygen saturation. When a patient shows signs of hypoxemia, low oxygen saturation less than 94%, provide oxygen supplementation. Close monitoring is recommended at this point with a cardiac monitor. Of course, requesting a 12-lead ECG is necessary. Obtaining intravenous access is likewise recommended in case emergency medications are required. With all this information, the clinician is able to come up with a possible diagnosis for the patient's medical condition. Refer to Box 2 of the adult bradycardia with a pulse algorithm. The next questions to answer are: 1. Are the patient's signs and symptoms of bradycardia cardiac in origin? And 2. Are there any other clinical conditions that have brought about bradycardia in this patient? Answering these questions leads to the interventions a clinician must choose to treat the patient. If after improving oxygenation the patient's symptoms diminish, then the clinician may opt to just monitor the patient and decide whether to admit the patient for further assessment. These patients are, of course, stable. That's it for our lesson today. Thanks for watching, and remember to check out our website at aclscertification.org for more free content or to get certified or recertified online.